Hello, lovelies. Welcome to the channel. My name is AJ, and today we are going to talk about ovarian cancer. But before we get into that, I need to put out this disclaimer. The content of this video is for educational or academic purposes and then awareness or preventive purposes only. That means this video is not a replacement for professional medical advice or treatment. So all our audience and viewers who consume this content, if any of you faces any of these conditions or challenges related to these conditions, please seek professional medical advice. Contact your primary healthcare provider so that you'll be provided with the necessary assistance and then care and treatment that you deserve. Also, the images used in the creation of this presentation remains the property of the original creators and authors, and as such, at the end of this video, a reference list will be provided so that proper accreditation can be given to the original creators of those images and informations, and then our viewers can also confirm for themselves the source of our information. Thank you.
Now, before we go into our topic for today, let's have an overview of the gynecological cancers. There are 5 gynecological cancers, namely uterine cancer, ovarian cancer, cervical cancer, vaginal cancer, and then finally vulvar cancer. Out of these 5 gynecological cancers, only one is popularly known, and that is the cervical cancer. Most people know about cervical cancer because there is a standard procedure to diagnose it. Even the causative organism for cervical cancer is known. Its signs and symptoms are a bit distinct from other conditions. Unlike cervical cancer, the remaining 4 gynecological cancers are quite difficult to detect and then diagnose. This is because they have, especially for ovarian cancer and uterine cancer, they have the ability to mimic the signs and symptoms of other conditions, making their detection and then diagnosis difficult. Generally, treatment and then prognosis for these 2 conditions, that is ovarian cancer and uterine cancer, are not good or are not best or encouraging because most of the times their diagnoses are made at the later stage or at their end stages where little can be done or only palliative care can be provided. September has been dedicated as the Gynecological Cancers Awareness Month, and that is why this month we are going to talk about these 2 fatal gynecological cancers that most of us don't know about. So, once again, what is ovarian cancer? Ovarian cancer is a relentless disease which is characterized by abnormal growth of cells in the ovaries and then often present with subtle or non-specific symptoms in its early stage, making detection and then proper diagnosis very difficult. The signs and symptoms of ovarian cancer are similar or sometimes even same for other conditions as well. So using the signs and symptoms alone to detect it is very difficult. As one of the fatal gynecological malignancies, ovarian cancer is typically diagnosed at an advanced stage, which makes treatment very demanding and leads to reduction in overall survival rate. As I said earlier, ovarian cancer can mimic the signs and symptoms of other conditions. What the signs and symptoms of ovarian cancer is similar to the signs and symptoms of other reproductive health conditions. So making an early detection or a proper diagnosis is very difficult. Most of the time, before an ovarian cancer can be properly or finally diagnosed, the patient might have reached the end or terminal stage, and this leads to an overall reduction in treatment and then survival rates. Let's look at an anatomy of what a normal ovary looks like and then a malignant ovary, and then what our female reproductive system is supposed to look like. This is what a normal ovary with no cyst or tumor looks like. Forget about the numbers. This whitish thing here is a normal ovary. Anatomically, this is what it contains. We have an outer layer we call the epithelial layer. We have the stromal layer with these small dots here. And then we have the follicular or germinal layer, which contains the ovums that will mature and then finally rupture when it's time for ovulation and then menstruation. This is what a normal ovary looks like. This is what our pelvis looks like. The ovary lies in the pelvis with other reproductive organs, the fallopian tubes, the uterus, the cervix, the vaginal canal, and then these are the pelvic bone which encloses or protects these organs. So this is what a normal reproductive system in the pelvic region of a woman looks like. Now, this is a malignant or a cancerous ovary. The reason why I did not put a normal picture like this one or a live picture like this one here is because the graphics of the images that I found are quite intense. I'm not sure if YouTube will permit that, so we will stick with this one. Let's just manage. So this is what a cancerous ovary looks like. This is a normal ovary and a cancerous one. So you can imagine if this whitish thing here is just like this and then it suddenly becomes cancerous, just imagine what it will be looking like in the body. There are various types of ovarian cancer. We have 3 of them. We have epithelial ovarian cancer, stromal tumors or malignancies, and then the germinal cell tumors. These types are made based on the kind of cell or the type of cell where the cancers develop. The epithelial ovarian cells, which is the epithelial ovarian cancer, which is the most common of all the 3 types, develops from the epithelial layer. And then the stromal cancers develop from the stromal layer, while the germ cell tumors occur or develops from the follicular or the germ cell layers. Now, these germ cell tumors and the stromal cells are all rare types of ovarian cancer, but the germ cell tumors mostly occur, they are rare, but if they do occur, they occur in women of younger ages, maybe between the ages of 15 to 39. These are if such a woman should develop an ovarian cancer, this is the type of tumors that we are going to see in that patient. Like every other malignancy or cancer, there are stages to it. Ovarian cancer have 4 distinct stages. Stage 1 is when the malignancy is found within both ovaries, either one or both of them. It is confined to either one or both ovaries. It hasn't spread to any other parts of the reproductive system within the pelvic region. Stage 2 is when the cancer has spread to the uterus or other nearby organs. At this point, the uterus, the fallopian tubes, or even the cervix may be infected at this time. The cancer might have metastasized into those organs, but it is still within the pelvic region. It hasn't gone beyond it. Stage 3 is when the cancer has spread to the lymph nodes or the abdominal lining. Now, within the pelvic region, apart from the pelvic bone and the organs within it, there is a peritoneal lining that covers them. So when the cancer metastasizes or reaches that peritoneal abdominal lining, we say that the ovarian cancer has reached stage 3 and that is has gone beyond the pelvic region. Then the stage 4, which is the final or terminal stage, this is when ovarian cancer has spread beyond both the pelvic and abdominal region to distant organs such as the lungs or the liver. So this is a picture depicting the stages of the ovarian cancer. This is stage 1, where we have the tumors in just the ovaries. Stage 2, we have the tumors in other parts of the reproductive organs within the pelvis. It's within the uterus, outside of the uterus, and then the ovaries, and even the cervix is being affected. Stage 3 is when it goes beyond the pelvic region into the abdominal cavity or the peritoneum, as you can see here. And then stage 4, as we mentioned, is when it has spread to distal organs like the liver and then the lungs. So what are some of the causes or risk factors for ovarian cancer? The exact cause of ovarian cancer is not known. We cannot say that ovarian cancer is caused by this bacteria, virus, or parasite, but there are some risk factors that we can consider. There are certain things that will make a woman at risk or at higher risk of developing ovarian cancer. The first one is advanced age. As a woman When your age increases, you are at risk of getting ovarian cancer. We can talk about early onset menarche and then late onset menopause. Menarche here refers to the menstrual cycle. If you are someone who had your menstrual period or begin to experience your menstrual cycle as early as age 10, 11, 12, you are at risk of developing this ovarian cancers. And then late onset menopause, by age 50-55, we are expecting that a woman had fully entered into menopause. If your menopause goes beyond this age range before it begins, you are at risk of developing ovarian cancer. Then family history, if there is anyone in your family who had ever had ovarian cancer, you are also at risk of developing ovarian cancer, because ovarian cancer is hereditary. Then genetic mutations in the BRCA1 and then BRCA2 genes. These two genes are responsible for causing breast cancer, and hence any abnormalities or changes in them can also predispose a woman to developing ovarian cancer. Then nulliparity, this means a woman who has not given birth before, you are at risk for ovarian cancer. And then elderly primipara is a woman who has her first pregnancy at an advanced age, as late as maybe age 40 or age 45, 42, 45. This is when you are having your first pregnancy, you are at risk of developing ovarian cancer. Obesity, then smoking, and then endometriosis. Endometriosis is when part of the uterine lining grows outside of the uterus or the womb. The uterus has three distinct linings. We have the endometrial lining, myometrium, and then perimetrium. Now, with the endometrial lining, that is the inner lining of the uterus or womb. If part or any of it develops outside of the uterus, that is what leads to endometriosis, and that can also cause or lead to ovarian cancer. Then hormone replacement therapies. You know, ovarian cancer develops out of the hormonal cycles responsible for ovulation and then menstruation. So any disturbances or any changes in the natural hormonal cycle responsible for ovulation and menstruation can lead to ovarian cancer. Let's look at some signs and symptoms of ovarian cancer. As I said earlier at the beginning of today's video, let me repeat it again. The signs and symptoms of ovarian cancer are not peculiar to ovarian cancer alone, because there are other conditions that present the same signs or same or similar symptoms. And nonetheless, we are still going to go over them. The first one is abdominal bloating or swelling. Normally, if you are going through ovulation, about 90% of women experience abdominal bloating or some swelling during ovulation. Abnormal changes in menstrual cycle, which does occur if you are experiencing maybe changes in environment, some stress at work, or even if you are sick, this can affect your menstrual cycle. So once again, this is not peculiar to ovarian cancer alone. Quickly feeling full when eating. This can even be an normal abdominal cancer, like a gastric cancer leading to this. But once again, it can be a sign or symptom of ovarian cancer. Weight loss, especially the unexplained weight loss. You don't know, you are eating, you are healthy, you are not feeling sick, but you are losing weight. Discomfort in the pelvic area, which is even common with normal ovulation. Once again, fatigue, back pain, because when this mass continues to grow, as this tumors continues to increase in size, they begin to put pressure on surrounding organs and nerve tissues, and this can lead to back pain, changes in bowel habits such as constipation, and then a frequent need to urinate. As I said earlier, an increase in these tumors or masses will put pressure on the surrounding organs, be it the intestines or colon and then the bladder, and this is what will lead to the constipation and a frequent need to urinate. Now, who is at risk of developing ovarian cancer? Ovarian cancer is common in women aged 40 and above. However, there are rare instances when it can occur in women younger than age 40. Thus, women aged between 15 and 39 can also develop a certain type of ovarian cancer known as the germ cell tumor or carcinoma. Yes, ovarian cancer is more common in women aged 40 and above, but it can still occur in younger women, even teenagers and adolescents. To diagnose ovarian cancer, you have to go through a series of procedures. There is no one distinct or standard or specific diagnosis for ovarian cancer. So the first one of this series of processes is the signs and symptoms that a patient will present. It needs to be studied and investigated further. After that, an ultrasound may be performed, a pelvic ultrasound, preferably the transvaginal ultrasound, then tissue biopsy, blood test, and then some imaging tests such as MRI, CT scan, and then PET scan. With the blood test, what the clinician will be looking out for is the CA1252 marker. This protein in the blood is responsible for marking out cancers. So excess of it in your blood will indicate that there is a cancer developing or you are at risk of developing cancer. And then this will prompt further investigation to know the exact kind of cancer that you are at risk of developing. Everything has effects or complications on our body, all conditions and disease, and ovarian cancer is no different. If left untreated, it can lead to complications such as ascites, bowel obstruction, pleural effusion, and then bladder obstruction. Ascites is accumulation of fluid within the peritoneal cavity. That is when the ovarian cancer progresses from stage 2 to stage 3. When the abdominal lining is infected, it will lead to ascites. And then pleural effusion is accumulation of fluid within the lung coverings, or the pleural coverings. So when the ovarian cancer reaches stage 4 or the terminal stage, where it travels to distant organs such as the liver and the lungs, it will lead to pleural effusion. We already talked about bladder obstruction and then bowel obstruction or constipation in the previous slide, when we explained that as the tumors increase in size, they put pressure on the surrounding tissues or organs, and they can lead to the bowel obstructions and bladder obstructions. For women who succumb to ovarian cancer in the last 6 months of their lives, these are some of the signs and symptoms that you'll be seeing in them. We have severe fatigue or weakness, excessive vomiting or nausea, constipation, pedal edema, and then anemia. All tumors and cancers need blood supply, rich blood supply to grow. So these cancers will develop their own blood network, and then they will be sucking out the blood that is supposed to go into circulation for every tissue or organ in the body to benefit from. They will be sucking it all to themselves, and that is what will lead to anemia. And then pedal edema, this is where the feet or foot, yes, feet is for both legs, so the feet or the foot will swell up. It will swell up even though there is no inflammation or there is no injury to the feet. The feet or foot will suddenly swell up, and that is what we call pedal edema. The swelling is mostly centered around the ankle. That is what we call pedal edema. Ovarian cancer can be prevented, and there are some preventive methods that we can talk about. You have oral contraceptives, bilateral tubal ligation, breastfeeding, multiparity, regular health checkups. When we talk about oral contraceptive, I mentioned earlier that the ovarian cancer follows the hormonal cycle responsible for the normal menstrual flow and then ovulation. So any disruption or any changes in them can also prevent ovarian cancer. Normally, when a woman ovulates, there is a rupture of ovarian follicles. That to release the ovum, and that will lead to an inflammatory process. That inflammatory and healing process is what predisposes a woman to ovarian cancer. So anybody taking oral contraceptives, we know that these are artificial hormones that may make the effects of the natural hormones. When they circulate in your blood, your brain does not signal the glands responsible producing the natural hormones to produce them, because they are sensing that there are enough of this hormones in the blood. Meanwhile, these hormones are artificial hormones, so they cannot produce the natural effects of those natural hormones. That means for an ovary to mature, or an ovum to mature and then rupture and lead to this inflammation and healing process, that process will be interrupted. It's not going to happen. That means the risk of developing ovarian cancer will be reduced. Then tubal ligation or salpingectomy. This is when the fallopian tubes are cut and then tied. Breastfeeding. Pregnancy and breastfeeding have their own hormones at play, and this suppresses the effects of the normal hormones responsible for ovulation and menstruation. Hence, once again, for an ovum to the process of an ovum growing and then rupturing and leading to an inflammation and all that, once again will be interrupted. Then multiparity. The more you give birth, the lesser your chance of getting ovarian cancer. But please, everything has its pros and cons. Multiparity may help prevent an ovarian cancer, but it can also lead to postpartum hemorrhage and maternal death. So if you are considering this as your preventive method, please make sure you think about it properly and then consider all the options and side effects. Then regular health checkups, which is always my favorite. We've already mentioned that ovarian cancer, the signs and symptoms of ovarian cancer are not peculiar to ovarian cancer alone. So attending your regular health checkups can help us know your overall health status and know if something is wrong with your body internally. I always advise and plead with clients and patients that even if you cannot afford as a woman to go for checkup twice in a year, please do it at least once a year. Go for a regular health checkup to know what is going on within your body internally. Now, treatments. There are 3 main treatment modalities for ovarian cancer. That is surgery, chemotherapy, and radiotherapy. But before all this can happen, we first need to look at the size and type of ovarian cancer, the location of the cancer, the degree of metastasis. We are talking about the stage, whether it's in stage 1, stage 2, stage 3, or stage 4. And then the overall health status of the patient. This will determine whether you need surgery, chemotherapy, or radiotherapy. Most of the times, all these 3 treatment modalities are applied together. Some patients will undergo chemo, radiotherapy, and then finally surgery, while some patients will also go through surgery, then chemo, and then finally radiotherapy. There are other treatment options such as targeted medicines and then hormone treatments. Targeted medicines focus on killing or restricting the growth of everything that the cancer cells will feed on. So these targeted medicines, their major purpose is to starve the cancer or the tumors. Yes, everything that the cancer eats, these medicines focus on destroying that so that the cancer will starve and then probably shrink in size and die off. And then these hormone treatments are meant for interrupting the hormones that these cancers feed on, their cycle or their growth. These hormone treatments are meant for interrupting that. The same way, just like the targeted medicines are meant for starving the cancers, these hormonal treatments also have the same effect to prevent the effects and then the effects of these natural hormones that the cancers feed on, so that the cancers will shrink or die off. So, truths and misconceptions about ovarian cancer. This is always my favorite part of all the presentations. There are lots of myths and misconceptions about all forms of health conditions out there, and ovarian cancer is no different. But we are going to look at about 5 or 6 of them and then try to disprove or resolve all these concerns. So the first one says ovarian cancer can be detected by HPV screening test or pap smear. The HPV screening test is an early detection for cervical cancer. My people, please, HPV or pap smear has nothing to do with ovarian cancer. It is strictly for cervical cancers. It does not relate to ovarian cancer in any way. It cannot be used as a detection or a diagnosis tool for ovarian cancer in any way. It is solely meant for cervical cancer. The diagnostic tests for ovarian cancer include transvaginal ultrasounds, pelvic examinations, and blood tests that measure the CA125 protein levels. However, these tests may not always provide reliable results, and a surgical procedure is necessary to definitively confirm a diagnosis of ovarian cancer. As I said earlier, to detect and diagnose ovarian cancer, you need to go through about 4 procedures: the signs and symptoms, ultrasounds, blood tests, and then imaging tests. But even all that cannot sometimes be used as a definitive diagnosis for ovarian cancer. So finally, you may need to go through a surgical procedure. This will be a laparoscopy through a laparotomy in the abdomen to view the contents of the pelvic region to make a final diagnosis of ovarian cancer. Also, during this surgical procedure, a tissue from the tumor will be taken for tissue biopsy to confirm the type of ovarian cancer. Is it an epithelial, a stromal, or a germinal cell carcinoma? The second one says, I'm only at risk if I have a family history of ovarian cancer, which is not true. Every woman, as long as you have ovaries and uterus within you, you are at risk of developing ovarian cancer at some point in your life. However, there are some individuals who are at higher risk. That is the individuals with family history of both ovarian cancer and then even breast cancer, because if there is a mutation in the BRCA1 or BRCA2 genes, this can predispose or lead to the development of ovarian cancer. So please, all women, as long as you have ovaries in you, you are at risk of developing ovarian cancer. But once again, some people are at a higher risk than others, especially those who have a family history of such conditions and conditions like breast cancer because of the BRCA1 and BRCA2 genes. Then this one is saying hysterectomy prevents ovarian cancer. That's another inaccurate statement over there. The risk of developing ovarian cancer depends on the type of hysterectomy that is performed. We have a subtotal hysterectomy and then a total hysterectomy. Subtotal hysterectomy is when the upper part of the uterus alone is removed, and then a total hysterectomy is when the entire uterus is removed. Now, the upper part of the uterus can be removed together with the ovaries, and that may prevent ovarian cancer. Also, the entire uterus can be removed together with the ovaries, and that will also help prevent ovarian cancer. If the ovaries are removed alone, that procedure is known as oophorectomy, and if the ovaries are removed together with the fallopian tubes, that procedure is known as the salpingo-oophorectomy. So sometimes the ovaries alone can be removed, and then the uterus and the fallopian tube will be hanging there intact within the pelvis. Sometimes, depending on the conditions, both the ovaries and then the upper part of the uterus will be removed, and then the other parts will be left intact. So a hysterectomy may not necessarily prevent ovarian cancer. It will depend on the type of hysterectomy that was performed. Was the upper part removed together with the ovaries and the fallopian tubes, or was this just this lower part that was removed? Please, let's take note of that. Hysterectomy does not necessarily prevent ovarian cancer. Ovarian cancer is detected only at later stages. This is another misconception or false statement. It is true that about 90% of ovarian cancer diagnosis happen in the later stages, that is stage 3 and stage 4. But an early diagnosis can still be made, especially for clients or patients who pay attention to their body and then their overall health. If there is someone who likes going for regular health checkups and then pay attention to the subtle changes that occurs in their reproductive health or reproductive life, ovarian cancer can be diagnosed in an early stage. So says while it is true that most ovarian cancers are diagnosed at stage 4 and 3, it is possible to identify ovarian cancer in its early stage when it is still small and has not spread to other parts. Therefore, it is crucial to be aware of the early warning signs. Women should consult a general practitioner if they experience persistent symptoms that are unusual for them, especially unusual persistent changes in your menstrual cycle, abdominal or pelvic pain or bloating, unexplained weight gain or weight loss, or persistent fatigue, extreme fatigue. If you notice all of these things, please consult a physician or a clinician for proper investigations and diagnosis to be made. Then the last but not the least says ovarian cyst can turn into cancer, which is a very, very, very false statement. Please, ovarian cyst has nothing to do with ovarian cancer. In fact, about 25% of cysts are benign and then they resolve on their own without treatment. The only time an ovarian cyst may be removed will be when they are causing severe pain or they change in appearance or size. So if they are causing too much pain for the patient, or the size and then appearance of the cyst changes, then the cyst may be removed. Other than that, ovarian cyst is always left alone to resolve on its own because it is benign. It has nothing to do with ovarian cancer. And even before the cyst will be removed, some tests such as blood test, medical imaging test, and then the patient's or overall patient symptom presenting signs and symptoms and age will be considered before this cyst will be diagnosed properly and even removed. All these things must be considered. So please, once again, ovarian cyst has nothing to do with ovarian cancer. All ovarian cysts are mostly benign, and then your clinician may suggest removal of the cyst only when it's causing too much pain or the size and then appearance changes. In summary, we can say that ovarian cancer is one of the deadliest gynecological cancers and is second to only breast cancer in terms of death or fatalities. Many women lack knowledge on this condition due to the fact that it can mimic other diseases, making collection of data on it as well as the diagnosis very challenging. The best way to prevent ovarian cancer is to know your risk status and also seek prompt medical care whenever you notice persistent or unusual changes in your menstrual cycles, bowel habits, and general reproductive health. Note that ovarian cancer can reoccur after treatment because some of the cells may have migrated to other parts of the body. So continual follow-up visits is necessary after or post-treatment. Dear lovelies, be an advocate now and save a life. I always say this. Be an advocate and save a life. Talk about ovarian cancer, discuss it, spread the information about it, help create awareness wherever you are so that people will know about it. There are a lot of women living with ovarian cancer, but they do not know. By the time that the diagnosis will be made, they are already in their terminal stages and little can be done about it. So let's help save someone's life by spreading this message. These are the reference links that I mentioned in my disclaimer. For the stages of ovarian cancer, there are sub-stages to all the 4 distinct stages that we saw. Stage 1 has a sub-stage A, B. Stage 2 has A1, B1, A2, B2, and the rest. So to know more about the stages of ovarian cancer, you can visit this website. The sub-stages, let me highlight it. Okay, lovelies, that is all there is for today. Thank you so much for joining us. Don't forget to share, comment, like and then subscribe to the channel. Your comments are very important to me. I hope you are all going to drop your comments about things that you think I could have included or things that I should omit in subsequent videos. And if there is any health condition that you've heard about and would like to know more about it, please do put it in the comment section, and then I will go and research on it and bring more information so that we all learn together. Your comments mean a lot to me, so please do comment on this video, and then put us on notifications so that when we upload the other video on uterine cancer, you'll be able to watch that one too and learn one or two for yourself. Once again, thank you so much for joining us. See you in the next video. Bye.